4, 3.
Good afternoon, and welcome to this virtual town hall at VA headquarters here in Washington, D.C. My name is Bill Rauch, the Executive Director of Got Your Six, an organization that is focused on empowering veterans to lead a resurgence of community across the nation. I'm also an Iraq War veteran, having spent 10 years in the Army, including 17 months in Iraq, and I'm enrolled in the VA Medical Center here in Washington, D.C., just 3 miles up the road. It's my absolute honor to host this event today with Dr. David Shulkin, who was sworn in just last week as the 9th Secretary of Veterans Affairs. Before that, Secretary Shulkin served 18 months as the Undersecretary of Health, leading the nation's largest integrated healthcare system with over 17 sites and caring for nearly 9 million veterans. A board-certified internist who still regularly sees patients at VA, Secretary Shulkin's priorities as Undersecretary were improving access, engaging employees, building a high-performance healthcare network, identifying and implementing best practices, and restoring public trust at VA. Secretary Shulkin, thank you for giving me and the veterans watching a chance to speak with you today.
Oh, thank you, Bill. And I just want to thank you not only for your service, but that your continued service to veterans. I know how important this is to you, and your organization's a great organization. So thank you for being here today.
Thank you, Mr. Secretary. Well, over the next 30 minutes, we're going to get to know you a little bit better, Mr. Secretary, and to get a better idea of where you'd like to take the department as you work to put veterans first. We're also interested in hearing from veterans that are listening in online. So if you'd like to ask the Secretary a question, please leave it in the comments section and we'll get to it during this interview. Keep in mind we won't get to all of the questions, but we'll do our best. And then, of course, please do not leave any personal information or healthcare information in the comments. And with that, we'll get started. So, Secretary Shulkin, we know that you've run very large healthcare systems in the Northeast. You were the president and CEO of Beth Israel in New York City, and you've held numerous leadership roles, and you're still a practicing physician. So I have 2 questions. One, why did you give all of that up a year and a half ago to become the Undersecretary of Health? And after being the Undersecretary of Health for a year and a half, knowing how difficult the Secretary's job would be, why on earth would you take what we think is probably the second most difficult job in Washington, D.C.?
Well, I think the answer is I have a hard time saying no. I like to think I'm not unlike any other American. I watched as the crisis unfolded for VA, and I watched veterans not getting the care that any of us would want in terms of us failing them in the wait time crisis that we saw in April of 2014. And when my phone rang, I was running a hospital, I was the CEO, and I was asked, would you be willing to help? How could you say no? And so I'd like to think I did just what everyone else did, is I said, tell me how I can help, tell me how I can serve, and I came down to do that. In a very similar way, when I had the opportunity not too long ago to meet then with President-elect Trump, he said pretty much the same thing. He said, this matters to me. I care a lot about this issue. I want to fix VA healthcare, and I'm serious about that. And are you serious about that? And I said, that's why I came here in the first place. And I don't think any of us think the job is done yet. So I wanted to be able to continue to serve.
Thank you very much. And along that strain about some of the challenges that you have, we've seen a lot of questions already coming in from veterans surrounding the choice program and just care in the community in general. And we have a lot of programs, as you know, that allow folks to go into the community and receive the care they need. But because of that, it's confusing for veterans who are leaving questions, but also for VA employees. So one of the questions that we want to ask are, what are your plans to address the concerns with care in the community and make it something that's easy to understand, not only for VA employees, but also for the veteran?
Well, there's no doubt that the choice program, as it was authorized by Congress and the way that it's been implemented by VA, has been a very confusing program. It's complicated to use, and frankly, when you talk about it being complicated to use, that means that there are barriers that we've identified for veterans getting the care that they want in the time that they want it. So we know it needs to change. But there's also no doubt that in order for us to meet the needs of our veterans, the VA can't do it alone.
Right.
It needs to be working with the private sector, with community care healthcare providers. And so what we're seeking to do is to redesign the choice program in a way that actually allows veterans to seek care in the community when they need that care, but do it in a way that's simplified. And so we're working hard now with the President, with Congress, to be able to propose a choice system that actually is designed and created for the benefit of veterans. And that's what we're committed to do this year.
And just so I'm tracking, that includes all of these other programs, right? So there are other programs like PC3 and other contract programs to get care in the community. And your all's plan is really to sort of streamline and make it the same across the board, right?
Right now, there are about 7 different ways that we have to keep money, all that go towards providing care in the community for veterans.
Mm-hmm.
And of course, when you have 7 different ways of doing something, there are 7 different sets of rules.
Right.
And that's where it becomes complicated, not only for veterans, but also for our own staff to figure out how they get a veteran into the community.
Right.
Sometimes you have to call an insurance company, a third party, to be able to get permission to go out into the community. Other times a VA member can do it directly. So we're seeking a single way that actually is the easiest way for veterans to get that care in the community.
That's great. And I think appointments in the community are up a little bit from this last year, which was a record year, right?
Absolutely. When I started 18 months ago, we had about 21% of our care that was provided outside the VA in the community. Today, that's 31%. So that's essentially about 35% increase
Wow.
in the use of care in the community.
I think a lot of veterans would be surprised to hear that. I know I am a little bit. And to talk about an issue I think that's a little more familiar with our community, which is Agent Orange. We've also had a lot of questions come in from veterans and family members who wrote in to ask about these issues and specifically if additional conditions would be considered as presumptive diseases. In fact, Jack Klein, who wrote in, wanted to know if you would be considering adding lung diseases and hypertension to the Agent Orange presumptive disease listing, which was recommended by the Institute of Medicine, according to Jack.
Yeah, well, Jack, we're getting very close to being able to give you a final answer on that. As everyone knows who's followed this issue with Agent Orange, we have had multiple long-term studies looking at the impact of Agent Orange on veterans. And that's why in the years past we have had what's called presumptives for disability claims and medical care. Because of some new studies that have come out that have studied the conditions, Jack, that you're talking about, we're approaching in the next several weeks the ability to be able to have that data presented to me that will show the data to suggest whether it will be appropriate to grant additional presumptives. In other words, what's the causation between exposure to Agent Orange and conditions like hypertension and lung conditions. So I'm looking forward to being able to hear the results of that. I haven't been presented with that yet. I'm anxious to get it so that we can begin to get answers to people like Jack, because it's been too long that they've been waiting to get those answers.
No, thank you, and thanks for that question, Jack. The next question I think is interesting in the context of you were just in New York City earlier this week seeing patients.
Yes.
And with the white coat and the whole bit. As a reminder on the top, you're still a practicing physician. And I think you know that we have a huge shortage of mental health professionals across the country, not only in VA, but in the private sector. And so we had a question from Bradley Trimble, who had questions about resources for mental health. And given those shortages that we just talked about, what are your plans to tackle this issue? Because again, it's not just a VA issue, but it's an American issue. And he's interested to know what those plans are.
Well, I think you said it correctly. The VA, as the largest healthcare system in the country, tends to see the problems that exist all across the country in American healthcare, and we tend to see them early. So we've known for a long time that while in some areas, metropolitan areas, there may be a good supply of healthcare professionals, including mental health care professionals, when you start getting into other parts of the country, particularly rural areas, we see severe shortages. One of the ways that VA has begun to tackle this is by using technology, telemental health. And so last year we did over 336,000 telemental health visits. Nobody's doing this type of mental health care provision at the scope and scale that VA is. And we've established 5 telemental health hubs in areas of the country where there is a good supply of psychiatrists and psychologists. So we can provide that care to areas where they don't exist. So we're leveraging technology. We're also using one of our other missions, and that's education. We're expanding our residency programs to train more mental health professionals, more psychiatrists and psychologists. Not only that we hope that many of them will stay in VA, but also because we see part of our role in helping the country fulfill its shortage of mental health professionals. So this is very, very important for us. We are hiring mental health care professionals. We think that we have about 1,000 more that we need to hire to really begin to start addressing the needs that we want. But in the meantime, we will look at every avenue to try to address these needs like technology.
Yeah. And it's crazy you brought up the telehealth piece, because I actually went to a demonstration you all invited me to last year at my medical center, and they showed us the power of telehealth via an iPad and talking to a physician. It was really remarkable, frankly, and something I hadn't experienced before.
Yeah, I hadn't experienced this before I came to VA either. You mentioned that I see patients in New York City, where I do by going there, but I also see patients in Grants Pass, Oregon, which is a rural part of Oregon. I see it from my office upstairs right here in Washington, D.C. through telehealth, and I'm able to put on headphones and listen to the heart and lungs and do my examination. And I am really impressed at the quality of care that you can provide using this technology.
Well, I think that's really remarkable, because I believe that you are the first VA secretary who I can potentially get as a doctor. And so I suppose for everybody who's listening and watching and asking questions, there's a chance that Secretary Shulkin might be your physician. So I think that's pretty interesting, and I hope that my appointment at the DC Medical Center is when you come over. And
of course, when I see patients, I'm just a doctor. I'm not the secretary. So if you do, then just call me doctor.
Okay, I will. And so you brought up two pieces there, though, I think that warrant a couple follow-ups from other questions we saw. You mentioned the hiring of mental health professionals, and one of the questions we saw, multiple questions, have brought up this hiring freeze. And I know you mentioned this during your confirmation hearing, because there are some shortages in VA, but I think you've also assured us and worked with the White House that those key positions, you still have the authority to hire folks. Could you talk a little bit about that?
Yeah, of course, I think as everybody knows, we're really working our way out of this access crisis. And so a hiring freeze for us, where we need to hire doctors, nurses, psychologists, and pharmacists, all sorts of healthcare workers, would be disastrous. So we went right to the White House. The White House was absolutely terrific in giving us an immediate response that when it comes to hiring direct care professionals, that we would be exempt from the hiring freeze. So while we certainly understand what the president seeks to do in the hiring freeze, and we're supportive of that, in areas that relate to public health and safety, there are exceptions to the hiring freeze, and we very much appreciate that.
And that's important, because folks did have questions for that, so I appreciate you addressing it. And I also want to get back to the fact that you are a doctor. You also mentioned the VA trains physicians, and that there are multiple partnerships with universities and medical schools across the country, because we did a little bit of homework, and we know that you're in the category of, I think, over 70% of doctors in America who do a residency at a VA hospital. And so I wanted to ask you, where did you do your residency, at what VA hospital, and what was that like for you as a young doctor?
Well, I think that statistic where a U.S. medical student will, 70% of them will rotate through a VA hospital, is reflective of my own experience. In my training, I actually worked in 3 VA hospitals.
Oh, wow,
in medical school at the Philadelphia VA Medical Center. In my first year of my residency, what's called an internship, at the Yale or West Haven Medical Center in Connecticut. And then in my residency in internal medicine at the University of Pittsburgh, at the Pittsburgh VA Medical Center. So the VA was essential for my training, and I'm very, very grateful. And one of the reasons why I feel so passionate about giving back to veterans, not only because of my gratitude to the VA, but because of my family, that my father, a U.S. Army veteran, my grandfather's Army veterans, my grandfather who served as actually the first pharmacist of the VA in Madison, Wisconsin. So this has always been, the VA has always been central and important to me.
Well, I think it's great that they were all in the Army, as an Army veteran, of course, but we love all services. And, one of the things about my time in the Army, and a lot of folks who served, especially post 9/11, we have the new GI Bill. And so we have had a lot of questions about the new GI Bill, one in particular from Joe, who asked how the VA can better support vets on campus. And we're fortunate that because just today, our friends and partners at Student Veterans of America have released a report using VA data that shows veterans as one of the most successful cohort of students on campuses across the country. So the two questions, I think, are, to Joe's point, what can we continue to do to support veterans on campus? But then more broadly, how can we tell this good news story that veterans are succeeding on college campuses at a rate much, much higher than other folks? Because frankly, that's just not the narrative that a lot of folks are aware of. And so what are your thoughts on that?
Right. Well, you know, the GI Bill clearly is a American success story, and I think it's one of the things that is one of the ways that we not only can continue to help veterans serve the country after they're out of service, because these are great people with great leadership and management skills who go on to get education and then go out and lead American businesses and create jobs and help the economy. So this is something that we are very supportive of. We're continuing to look for better ways to make this even greater value to veterans. I think that there's been a lot of attention about schools that have been not providing the high quality type of education that we've been proactive in addressing. So we continue to look for ways to do that. And I think Student Veterans of, the Student Association for Veterans is one of those organizations that we really value as a partner.
And it's great to hear you say that, because we know at Got Your Six that you are very focused on partnerships, and we want to talk a little bit more about that here in a second. I think first, we wanted to address some questions that have been coming in terms of the claims backlog, specifically as it relates to appeals. And again, this is an issue you're familiar with, but we got a question from Suzanne McCarthy, who's the wife of a disabled Vietnam veteran, and her question is, when will the backlog of appeals be reduced? That's simple. She said her husband's going to be 70 years old, and should he or any veteran have to wait 3, 4, 5 years for a decision?
Yeah. The appeals issue, I'm very, very sensitive to this question. The appeals issue is clearly unacceptable to us. Unfortunately, we've come to the conclusion that unless we get legislative changes in how we do appeals, we are not going to be able to fix this the way that we want to for families and for veterans. That the system itself is designed in such a way that structurally the appeals backlog will probably grow, not lessen, and that's just unacceptable to us. Right. We've worked with our veteran service organizations, we've worked with members of Congress, we've worked with our lawyers and other leaders in VA to come up with what we believe is a really good piece of legislation that would begin to address this and is necessary. And we hope that that will be introduced in the 115th Congress, and we hope that we'll get the support to be able to have that fixed and passed in Congress.
Well, I think that's an important point as well. I know that before I started to become involved as a veteran service organization myself, I wasn't aware that a lot of these comprehensive reforms required congressional action. And I know that we've been involved a little bit with the appeals process, and the plan that you all have needs congressional authority before you can implement it, right?
Yes, okay. Yes, that's true. I mean, just to give you a sense, we have one appeal that's going on now more than 30 years. And the reason, to give the people who are listening a sense.
I'm barely older than that.
Right. It wasn't yours.
Okay,
that's the good
right,
news.
Okay.
Okay. So the reason is the way that our system is currently designed, you can continue as a veteran to add additional evidence into your appeals process at any point. So you could be almost ready for a decision and then add a new piece of evidence, and then it starts over in the cycle. So that's how something could extend for 30 years. We don't think that's good for veterans. Right. We think that when you're taking up that much time on one appeal, that's hurting other veterans who need their cases heard, and we certainly want to give every veteran every opportunity to make sure that they're getting all of the benefits that they deserve. So we want to fix this system once and for all.
No, that's great. And it's great that there's a proposal, frankly, that Congress can look at. And so now the next question is something that relates to service the VA provides that a lot of folks don't think about, and that's memorial benefits. And I think this is a timely question because just recently I received a call from a friend of mine who had a friend of the family who had lost a loved one, a Vietnam veteran. And I didn't know how to help them, so I called your staff. You may not know this, but I called your staff to figure out how we could help those folks. And then we found out just recently you all have a new program related to a memorial benefit. So one of the questions we wanted to ask, given folks don't talk about memorial benefits much, is how do folks make plans to get a burial in a VA National Cemetery? And so you have a new program, and I wrote it down because it has a long name. It's called Pre-Need Burial Eligibility Determination. So there's a couple of questions. One, what is it? How's it different from past programs? And what's it mean for veterans and our families?
Well, first of all, we're very, very proud of the services that we give through our memorial benefits. And I think really to do justice to this, and so I really appreciate you asking about this, we have with us our acting Undersecretary for Memorial Services, Mr. Ron Walters. So I'm going to pass the microphone to him because I think he'll do a better job of explaining this.
Thank you, Mr. Secretary, and thank you for the question. The Pre-Need Eligibility Program is a new program that the National Cemetery Administration here at the VA has introduced to help facilitate burial planning for veterans and their families. In the past, pre-need was not available. In other words, we would provide eligibility determinations only at the time of need. That means when someone actually passed away. That certainly did not facilitate burial planning. It was inconsistent with private sector practice, and it also added to what was already a stressful situation. So with the introduction of the Pre-Need Eligibility Program, what we now do is upon application at any time, we will determine the eligibility of a veteran or family member, and that helps to facilitate their burial planning, end-of-life planning, and also makes it easier for them, when the time does come for them to utilize our service. Since the introduction of the program, we've had over 10,000 applications, wow. And we just formally rolled out the program in December of 2016. If you're interested in learning more about the program or applying for it, please go to www.cem.va.gov. And you'll find out more information about the program there. So we encourage you to do so.
That's great. And that's not a bad website for a VA website. That's cem.va.gov. And I can go there as a vet enrolled in VA and find out if I'm eligible.
Yes. Well, the application will then be sent to our eligibility and scheduling office, and they will, examine the records and other materials that are sent in, determine an eligibility, inform you of that eligibility, and we'll keep those records on file at our center so that when the time of need arises, it'll be on file and be ready to go.
Thank you. And, as a guy who's in his mid-30s, that's something we don't think about much, frankly, but it is an important question because, Dr. Shulkin, your memorial benefits work, that's top rated, right? It's #1 or #2 in the country, right?
Yeah, I actually think on the customer satisfaction survey we use, Memorial Services ranks #1 in the country. It ranks above many of the commercial companies out there. They do extraordinary service. Yeah. They have the sensitivity and respect that all of us want at that time for our service members that pass away.
Well, and I appreciate that, again, because literally weeks ago, I connected with your senior staff, and they were remarkable knowing the funeral home to call. It was remarkable. So it's great to hear there's a new program, and it sounds like it's a lot easier to use. We have time for a couple of more questions. We're running out, and I have a couple that we grabbed off the comments section, which we're going to get to right after this question. We've talked to a lot of veterans. We've heard from a lot of veterans. Some veterans feel that over the last year and a half since you've come on board as Undersecretary, before stepping up to be the Secretary, that there was some progress being made. Mm-hmm. Some veterans didn't think that there was progress. So two of the questions actually, what are you going to continue to do in terms of VA reform that you think was working? And then are you going to do anything different or new to address some of the concerns that folks have had that don't feel like reform's happening?
Yeah, I'm going to answer that question, and then I'm also going to ask for a lifeline on this. Okay. to my left. There is no doubt that VA had a complete failure in its confidence that veterans had in us, and I'm going to date that back to April 2014. There's also no doubt that we've been making true progress since that date in rebuilding the trust of our veterans. We measured it. We were as low as 47% of veterans expressed trust in the VA. We're now at 61%. So there's no doubt that we're making progress. But I will also say, and we do want to continue with the things that we know that are working, and we will continue to make continued progress in the areas that have worked for us over the past 2 years. However, there's no doubt that we need to do much, much more. No one on my team is satisfied with where we are, and we absolutely listen to our veterans and hear the stories where we continue to have opportunities to do much better. So we're going to be looking for some major changes. We're going to be looking to really reevaluate we do things. We're going to be listening to our veterans and working with our community partners to come up with new ways of transforming the way that VA delivers services. It's what I call modernizing our system. And if you listen to the president's 10-point plan, he's not looking for minor change. He was elected. The reason why I feel very fortunate that I got a 100-0 vote from the Senate in my confirmation is because there's one thing that the country agrees upon, and that is our veterans deserve better than what they're getting now. And that's the reason I believe I'm here, which is to help work with our employees to make sure that we do that. And so we're going to be serious about making major change to be able to get everybody to feel that they have a good, consistent experience when they come to VA. And I'm going to turn to my left and introduce Mr. Scott Blackburn, who is our Deputy Secretary, Acting Deputy Secretary of VA, who has been working very directly to make sure that the progress is being made and that the experience the veterans have is really the best.
Well, large-scale transformation's not easy, and the last 2 years, I think we've made a lot of progress, but we still have a long way to go. We're changing the culture. We're improving the veteran experience. We're improving the employee experience. We're getting more efficient with our operations. We're learning how to partner with the outside organizations. We're getting to be more disciplined with following up, setting the strategy, and following up and executing. We've had lots of great plans. Lots of reports have been done on the VA in the past. It is the ability to buckle down and stick to it and get the organization to execute. And that's what we've been continuing. We've put in some of the processes in place that are the building blocks. But as David mentioned, the president wants to do some really big things. We still have a long way to go. 61% on trust is nowhere near where we want to be. That should be well above 90. That's our goal, and we're not going to stop until we hit there.
Oh, that's great. And thank you and congratulations, because Scott was just today announced.
Yes, absolutely.
As the acting deputy, which we're running out of time, so I want to be quick. And get some questions from folks online. And Sandy asks, will we have more of these types of YouTube live meetings? 30 minutes is too short.
Okay, well, Sandy, we're going to look at the reaction and see what you think. You let us know, but if veterans want it, we're going to do more of them.
Yeah, and we're happy to help at any time to have this conversation. So Sandy, keep engaged. And let's see if we can do this again, because I think there are a lot of questions we haven't gotten to yet. Now, one of the things that I think is really, really important, and this is for Sandy and everyone else that's listening, I mean, we had the benefit of working with you when you were the undersecretary. We know you had a great relationship with veterans and veterans organizations in the broader community. So we know that when you succeed, the VA succeeds and the veteran succeeds. And so what can we do, whether we're an organization or an individual, what can we do to make sure that you're successful, because you do have a very difficult job?
Well, I think there's so many things. I think feedback from your customers is absolutely critical. We like to hear when we do a good job, because that reinforces that behavior. But when we fail you, we also like to hear about that as well. Secondly, I would say that we need everyone's help in changing the dialogue about the VA. I have been frustrated at only the bad news about VA getting out. And I'm not asking for a pass. When we fail veterans, I believe we deserve to be accountable. But this constant parade of negative stories, of accusations about the VA, I think hurts veterans. And what I worry about is the veteran is sitting at home who needs our help, who may be thinking about harming themselves or has a physical ailment that they need help. But they say, you know, I've been reading all these stories about VA. I'm not sure I want to go there. So they seek not to get help. That's what I worry about. Every day, we have thousands of employees who are doing great, fantastic work and helping many, many people. It's hard to get the positive story out. So I'm just asking for a fair, balanced view on what VA is so veterans can make good decisions about getting their services and health care.
No, and that's a great point. And, you know, given that it does take a team, it's a team sport, it's one team, one fight. I mean, another question that's come up is, you know, how much longer until you have the team that you need? And we know that DC is slow to move and government is slow and Congress can be slow. You know, you were just confirmed recently. You know, what are your expectations and what are you trying to do to make sure that you get your entire team on board so you can really tackle all of these changes?
Well, first of all, no excuses. I mean, we have to be hitting the ground running and starting the changes right now. And frankly, the president expects that of us. Mm-hmm. But we are looking to build out our team, and we are aggressively trying to make sure that we get the right people on the team rather than just do this fast. So as soon as we possibly can, we hope to have all of our leadership positions filled. But I want everybody to know people are working as hard as they possibly can to make the improvements that are needed. And we have terrific people here who are here for the right reasons, looking to make VA a better organization every day.
And, you know, I think we've got time for one more question, at least, before we wrap up. And this question is from Benjamin Bowles, who asks, what is Dr. Shulkin's strategy for ending veteran homelessness? Is this a top priority?
Well, I think veterans homelessness is a top priority of ours. As I hope people know, we have had a 47% reduction in veterans homelessness since VA started to focus on this in 2010. Last year, in 2016, we saw our biggest decrease in homelessness, a 17% decrease. And we continue to find additional ways to get those numbers of veterans who are homeless down, largely working in our communities, working with our cities, working with our states, working with private organizations. This weekend, I'll be meeting with the country's governors. One of the topics that we'll be talking about, how can we do more together between the state and federal government to address veterans homelessness? So you will continue to see that be a priority for us.
And I think that's important. And, you know, as we wrap up, you talked about good news stories. We talked about the GI Bill and how to talk about veterans being rock star students. I mean, at Got Your Six, we really focus on the fact that veterans are leaders and problem solvers and civic assets. That's the language we use. We know we're more likely to volunteer, we're more likely to vote, know our neighbor, and be really good citizens. And I think it's really important that when we talk about homelessness, you know, the VA is not just helping veterans get a home, but they're helping that veteran become an active citizen, a civic asset again in their community. And so, I mean, I think that's really, really exciting. And I think it frankly feeds into your point about, you know, these stories are not just about broken veterans, right? We're not all broken. We're not all, you know, damaged goods. Yes, some of us have problems. Some of us have been deployed to combat. Some of us have overcome trauma. But the VA is really there to not only give us these services, but to empower us, right?
Right. Absolutely. You said it very well.
And so, well, thank you. And I appreciate it. I know we've got to wrap up. And so, Secretary Shulkin, I wanted to give you the opportunity to share any final thoughts that you may have or anything we didn't miss or didn't address that you wanted to touch on before we close out.
Well, Bill, I just wanted to say how much we take seriously our mission to be able to serve America's veterans, and that the VA, we believe, is a really important national resource. That's why we're fighting so hard to make this system work. We do believe it's a system worth saving. We believe that, like every organization, that you need to look at things that are working and things that aren't working and to continue to evolve and change. And that's what you're going to see from this organization, a very hard-driving organization that's willing to make the changes necessary, but we need to do it in partnership with organizations like yours, with our other veteran service organizations, our community members, and our veterans together to be able to make this an organization that we all feel proud of.
Well, and I appreciate that. Thank you, Secretary Shulkin. And for those of you watching and listening in, it's worth noting that at your confirmation hearing, nearly every veteran service organization was represented. We had
Yes.
veterans who were there. And I think it's important because we all know there have been challenges. There have been real challenges and challenges that are inexcusable, frankly. But what we know at Got Your Six, having worked with you in the past, is that it's not insurmountable. We can overcome those challenges, and with the right leadership at VA and with the President's dedication behind reforming VA, we think that the VA can be a best-in-class organization. Frankly, it needs to be. And so we want to thank you, Secretary Shulkin. And so on behalf of Got Your Six, all of the veterans who are watching, I want to thank you. I want to thank you for stepping up, frankly. You say it's what anyone would do. I would argue that there probably aren't a whole lot of people who would take on the job. It is a tough job. And so we want to thank you for that. We are committed to working with you and your team to reform VA, making VA truly #MyVA, which I think we all want it to be. And we look forward to continuing the conversation. And so for those veterans who are still listening in, we at Got Your Six have got your six, but it's also important that we have the six of the Secretary and of all the VA employees who are doing the right thing. And when we have a bad experience, we need to reach out. Hopefully we will have another town hall so we can ask more and more questions and help the Secretary make VA a MyVA experience for all of us. Thank you.